Hey everyone, thank you guys for joining. It's 2:02 now, so we're going to go ahead and jump in. So first and foremost, thank you guys for joining us on the Costs of COVID webinar. We've got quite a bit of interesting content to cover today. Primarily, we're going to be discussing some COVID-19 planning strategies and some of the implications of cost in terms of maybe your benefit plans, as well as some things to consider from a facilities cost standpoint, if and when you decide to start bringing folks back into the office. Just a couple of quick housekeeping items. This is a RingCentral webinar, so audio has been muted for all the attendees. The only people that you will hear speaking, at least for the majority of the webinar, are myself and the other presenters. There is a Q&A button. If you do have any questions, feel free to utilize that feature. We'll be monitoring it throughout the presentation. If there's a question that really just makes sense, if we want to jump on it as part of the conversation, we'll do that. If not, we'll try to save time at the end to answer any of the questions that come through. Also, this webinar has been approved for 1 hour of continuing education credit through SHRM. So if you've got your SHRM CP or SHRM SCP, be on the lookout for that. We're going to be sending an email tomorrow. It'll have a copy of this presentation as well as the SHRM credit ID. So you can use that to put it into the website and get your credit. So don't worry about taking too many notes. Again, we're going to send a copy of this presentation to everybody who's interested. So with that being said, I'm going to start with a quick intro. As part of the presentation today, we've got 3 primary speakers. We've got myself, Robert. We've got Matt Brost from Holmes Murphy, he's an Enterprise Development Officer, as well as Leah Spohr. She is a Senior Clinical Consultant with Holmes Murphy. A little bit about me, kind of a career HR guy. I've gotten the opportunity to work with quite a few of you if you're an Encompass client. If not, it's great to meet you and being able to present some content. I'm really passionate about helping leaders just reach their goals through effective coaching strategies, effective management strategies, effective culture strategies, culture revitalization, that kind of thing. So really love being part of the Encompass group and helping folks get where they would like to go. So I'm going to pass it over to Matt for a quick introduction as well.
How's it going? It's a pleasure, certainly, to be on this webinar, and appreciate it, Robert. My name's Matt Brost. I'm the Enterprise Development Officer for Holmes Murphy. And really what that means is that I kind of help employers and our clients kind of navigate everything that we have at Holmes Murphy, because we do have a lot of solutions and a lot of different services that we can offer employers, and so I help navigate that. So you can kind of refer me a little bit to as an ambassador for Holmes Murphy in the market.
And hi everyone, I'm Leah Spohr. I'm the Senior Clinical Consultant with Holmes Murphy. I have been with the organization for about 1.5 years and was brought in to help lead up what we call our clinical strategies team. While I've only been with Holmes Murphy for 1.5 years, I have been in the industry for over 20 years. Can't believe I'm saying that. But my background is in public health. I have a master's of public health from Texas A&M. And upon receiving that, I started working in the hospital world. And my most recent stint prior to Holmes Murphy was with Baylor Scott & White Health, where I led up the health and wellness program for 13 years. And that's how I came to know Holmes Murphy. And I can tell you, I'm very glad to be out of the hospital business these days and onto this side of the house, and happy to talk with you today and tell you about what we have learned and are learning throughout this pandemic.
Perfect. Thank you, Matt. Thank you, Leah. So before we kind of dive into the content, for those of you who may not be Encompass clients, just a quick kind of overview of who we are, what is Encompass, what do we do? So we were founded almost 2 decades ago as a human capital management company, and really we're the all-encompassing solution for human capital management. We kind of break it out into 3 different buckets. First is the HR technology and solutions. We're your one-stop shop really for any pre-active and post-employment solutions. So before hire, during the employment experience, all the way up through offboarding, we can help automate every part of that process as part of our Encompass solution. Convenient, streamlined, and simple. Then we break into the human capital consulting, and this is kind of what, of course, I'm the most passionate about, being a human capital consultant here at Encompass. But really what we do there is help drive productivity to increase return on investment for our clients, rethink their HR strategies, really help them harness the potential that their employees already have by improving on the culture that they have, or really kind of doing an assessment and revamping that in culture entirely. Helping clients to mitigate risk while really utilizing the strengths of their unique workforce. So human capital consulting is a big part of our business. It's something I really enjoy doing. And then finally, we've got the talent management piece, attracting and retaining the right talent for your organization. We've got a team that really utilizes some unique sourcing strategies. We use behavioral assessments at sometimes as part of our recruitment process. So really, in terms of HR, we're truly the all-encompassing solution. So that's what we do here at Encompass. I'm going to pass it over to Matt to tell you a little bit about Holmes Murphy as well.
There you go. I did the first unmute for the call, but I appreciate it, Robert. Thank you. And so Holmes Murphy, many of you may have heard of Holmes Murphy, many of you may haven't. Holmes Murphy might not be one of the biggest names in the insurance industry when it comes to brokers, but we like to say we're small enough to listen, but big enough to be heard. We've got over 1,000 employees around the U.S. We have very robust and balanced practices, both in property and casualty and employee benefits. In our 15, really now 17 offices around the country, our Dallas office happens to be our employee benefits hub. And that's where you're gonna hear most of our conversation today on this webinar. So yeah, and we have over 1,000 employees around the U.S. But one of the most proud things I am about Holmes Murphy is that we're a very fiercely independent firm. There are many firms around the country who may have started privately held and went on to what they might think is bigger and better things. But being privately held for us and being fiercely independent in that really allows us to be nimble for all the employers that we represent. And we have over 100 shareholders that are all employees. So we actually are the largest employee-owned brokerage in the U.S. And so, yeah, just that nimbleness and the ability to adapt and really the care and attention that we put into all of our employers, whether it's on the property and casualty side or the employee benefits side, is what we really take the most pride in. And so I wanted to go ahead and kind of guide you in this next slide. Really, this is just us basically saying that this is not legal advice that we're giving you, and any kind of advice that you're hearing from this, we ask you to seek advice from your legal counsel, but we do not represent legal counsel for you here on this call. And so the webinar and the content of this webinar is really going to come out of a practice that we have at Holmes Murphy that we call our health asset team. At Holmes Murphy, we really try to think ahead. In everything we do, we try to think ahead. And our health asset team is really a team of people that Leah works very close to, so she will be able to speak to this too. But it's a team of people that instead of just looking at the whole health insurance industry altogether and seeing the trends that are in the health insurance industry altogether, it's a team of people that really looks at what you need for your employee population. And so it makes solutions that we offer, and to make sure that they really apply to your employee population. We have made a huge investment in IBM Watson to create a solution called Clue that really takes on the data of our employers and tries to predict what are maybe some of the conditions that we really need to focus on in your employee population. And all of that expertise and all that mindset of thinking ahead is what we're really going to talk about in this COVID-19 focused call that we're having right now. And so, yeah, that's what we're going to be doing. And I think I'm passing it off to Leah now. Maybe you, Robert.
Hey, I'll just give us a quick overview of the buckets that we're going to be talking about on this call. So really separated out into three different categories, and Leah is going to be driving the majority of this. So I'm going to hand it to her in just a second here. But first is the clinical considerations for COVID-19 management. And as we all know, this whole COVID-19 thing is continuously changing, right? If we've learned anything about this at this point, it's that we don't know yet what we don't know. So Leah is going to start by giving us some clinical updates with COVID. Then we're going to talk about some cost considerations and impact to the health budget of the organization. And I'm going to talk a little bit about the facilities budget as well. You know, going to your budget meetings and requesting a little bit more in terms of dollars, what that might look like, what you need to be thinking about there. And then we'll end it with some future considerations, right? What we need to be doing now to impact how we're doing business a little bit further down the road. So with that said, Leah, the floor is yours.
All right. Well, like Robert said, we're going to start with a little bit of clinical foundation for you. I'm sure you all are very familiar with many of these shown here on the screen. But why do we keep talking about them? Because they're important and they matter. And definitely from a clinical and a population perspective, they continue to be important. I know we've heard many times about physical distancing. You know, you hear it called social distancing, but I think it should really be called physical distancing because it's not about eliminating the connection we have with other humans. It's just about eliminating the physical closeness that we need to have with them during this transmission time of this disease. And for those that hate close talkers, you have every reason to back away from them now. So just remember that it's really a physical distancing you want to pay attention to. Aggressive hygiene continues to be extremely important. I can't stress it enough to wash your hands and avoid touching your face and cover your coughs and all those things. So just remember to practice those, especially as you come back into your workplaces. Personal protective equipment. The thing I want to emphasize here, and I know there's some controversy around this, but masks really are your friends. And they really are being even more so known to make a difference. There's a recent study out of London that was showing that the R naught value, or the reproduction or spread rate of the disease, can actually be reduced in half or more if you can get to greater than 95% of utilization with masks within a population. And that spread matters because the lower it goes, the better it is for all of us. So I would recommend that you strongly consider using a face covering while in public. And I think Robert will mention this as part of the facilities consideration as well. When it comes to contract tracing, I won't touch too much onto this because it does go into a little bit more of the public health realm. But I know a question we've been asked before is, what is the responsibility of the employer in this case if an employee was to come be found positive with COVID? How do we trace those people within our organization? And you do need to get in touch with that employee that may have been infected and need to make sure that they are tracing back as much as they possibly can remember who they've been in contact with. And then as your responsibility as the employer to notify others can come through email, it can come through direct communication, but you need to make sure that you are considering those HIPAA factors and making sure that you are not violating any of those by announcing anything about a name or who it might possibly be or their symptoms, anything like that. If you have more questions around that, you might want to get with your HR consultant to help you make sure you're covering all those bases. But I know that may continue to be an issue as things come up as we start returning to actual workplaces if you haven't already. And then the other thing that we'll talk a little bit more about is this testing component. And I know that too has been a crazy subject. We're hearing lots of different things about the PCR versus the antibody. And so I want to go a little bit more into that. And we'll show you on this next slide what that exactly looks like. I'm not going to go too detailed. There's a lot of information here on this slide that we'll be sure and share with you guys. But the thing I want you to know about testing is that we do know it needs to be a component. It is a piece, but it should not be the foundation of your strategy. And the reason I say that is because there are so many unknowns still that we are still trying to learn with this component when it comes to how this is impacting each person. Public health officials have agreed that the combined utilization of the PCR test coupled with the antibody testing would provide us a more complete picture of the progression of the disease within an individual and a population. But as you know, there's still a struggle with trying to get the right solution in that. So let me just one more time clarify for you the difference in case you haven't heard this yet. PCR tests, those are really used to detect the actual presence of the antigen, of the disease itself. And then it will involve telling you, do you have COVID-19? These tests can be very labor intensive. There's several stages where errors may occur between the sampling and the analysis. And so that's why we've had some concern around, requiring these. Some false negatives have been showing up about 30% of the time, just depending upon how that sample has been collected. The one thing we do know is that the EEOC has said this can be a required portion of your return to work or your HR strategy. This is the PCR, the diagnostic test. The antibody test, on the other hand, is different. It is the body's way of remembering how it responded to an infection and looking for what we call antibodies in your blood. People with antibodies, are able to fight the virus, we think, which lowers their risk of reinfection. What we don't know about these tests is how long does that antibody and that protection really last? Are we talking about 6 weeks? Are we talking about 6 months? Are we talking about years? That's still to be determined. And so the antibody testing can give somewhat of a false sense of security for those that may be tested as, yes, you have antibodies. And then they think, great, I'm in the clear. I can go out and live my life however I want. Unfortunately, what we don't know is how does that still impact your body later and the spread of the virus. I will say this, the EEOC has not taken a stance on antibody tests being allowed to be required. So I would proceed with caution in this area and make sure that you're considering that and leaning to your HR consultant for that as well. With regard to cost for this type of test, they're generally ranging from about $50 to $150. Some employers are asking if people want to, share in that cost, especially around the antibody testing, because there are some home testing kits that, yes, they have been FDA approved, are not funding through insurance. So again, you just need to take that into consideration as testing might need to become a part of your cost strategy and looking at that. What we're showing here on this slide now is really what we have started to look at when it comes to utilizing our data warehousing tool that Matt mentioned. We have a partnership with IBM Watson on, and really trying to understand the infection rates and help our groups understand what this impact might really look like on your population. And I'm sure you've all heard by now that there are several elements that you want to consider when it comes to how and who COVID is really impacting. Age, of course, is one of those that you see here on the screen. And what we know is that generally younger individuals have the less hospitalization and ICU admissions. It's really more of the older population that has been impacted so adversely with that. What you need to consider from a cost implication in this is if you know the age of your population, if you know that you have a generally older population than maybe the average employer does, then you need to be aware that this could impact you from a cost perspective, and the fact that they're more likely to have further clinical impact or further clinical intervention if they should become diagnosed with this disease. And then the next slide just goes into this a little bit more, another look and lens as to what else COVID is really impacting. And I think you probably all have heard this as well as regards to the chronic conditions and those with comorbidities, having that underlying health condition, especially those with cardiovascular or diabetes, respiratory infections, and just how much more that impacts that group as well. What is really helpful to groups is if you can understand the data within your population and know what risk you might have. If you are able to get to that level of detail and know that you have a lot of people with a cardiovascular condition or a diabetic in your population, it can too help you to kind of prepare for the potential impact in your cost or your budget should you have a high number of those within your population. So I would just ask and challenge that you speak with your HR consultant and try to learn as much as you can about your population and its health, because that's going to impact both your clinical and your cost sides. And then if you see here on this slide, this is really talking about the one thing that we may not have guessed early on that it was going to impact, and that's with regards to mental health. We didn't talk a lot about mental health before. It was becoming one of those diseases that we were willing to start talking about. And I hope that that's one good thing that can come out of this pandemic, is that we do need to talk about it more. We do need to be addressing it more. And it has played a key role in what's happening both within those that have a disease that they've been diagnosed with from a mental health condition, and for those that don't have one, and how just the physical distancing and how our shutdown of our economy and stay-at-home orders really have impacted mental health. And we've seen that with regards to information on how people are utilizing services. We've seen it with regards to pharmacy. In our latest results, we've seen that pharmacy utilization of those for that have mental health conditions has increased by over 10% during these last 3 months. So we know there's an impact on this. Again, I would tell you that make sure you understand where your population lies here. And then one thing that you really can start considering, and we'll talk a little bit about this more as we talk about future, but I want you to make sure you're looking at your EAPs. And I know you say, oh, we have an EAP, we've had one. 97% of employers say they have an EAP. Historically, utilization's been low. We know that. It's generally been between 1% and 3%. But if you have not considered this, think about it this way. The typical cost for an EAP is around $1 per employee per month. And sometimes it can even be included with your medical coverage or disability and provided at even no cost to you. Looking here and in our book of business, we know that the average diagnosis of mental health disease is around $1,000 per patient per year. And it represents about 10% of the employee population. So I'm going to give you an example here. I'm not the numbers girl, but I can do this math, and I think you can do it with me. Let's say you have 100 employees. And if 10%, which is the average in your book of business, have a mental health diagnosis, that's 10 employees, you'd expect a cost of around $10,000 per employee per year. Compare that to the cost of having an EAP that could help you avoid or potentially reduce some of that claims cost. And the EAP at $1 per employee per month comes in at $1,200 per year. So let that sink in. $1,200 of an investment versus $10,000 for diagnosis and cost associated with the mental health conditions. So the ultimate thing here is, if you can get awareness and raise awareness of these types of programs in your organization, I hope that utilization will increase and that it will help you to have some mitigation of some of those costs that could come out of this, and even in the future as well. So since I've talked about cost quite a bit, these are the kind of the four main areas that we've taken a look at when it comes to where the impact is really lying within both the clinical and the budget side of this thing. We're seeing several other variables that need to be considered here. And so I want to just kind of explain to you each one of these. I talked about the mental health increase. I talked about the need and this, especially the pharmacy increase that we're seeing. So look at that within your organization. The COVID-19 symptomatic cases. So the thing I want you to make sure of here is that you're thinking of those symptomatic ones. And that really plays into the infection rate, and whether you're having a small, a medium, or a large impact. You've got a budget for that somewhere, and your HR consultant groups should be able to help you do that. There are cost models that are out there that are looking at the estimated symptomatic rates. Ours range from 1% in the small range to 10% in the large range. Some of that is having to do with geography and where the clients are located. If you've got somebody that has employees up in the Northeast, they have definitely seen a high symptomatic rate. And so you want to take that into consideration with your budget. The COVID-19 testing rate that I mentioned earlier, and the range again is around $50 to $150 per test. You want to build something into your budget here potentially, just to make sure you've got that covered, because we do know that cost, if they should go and have it done, doesn't cost the the employee anything, but it would come through on your medical side. So we do need to make sure that is a consideration here. But the biggest contributor that I would say is probably this one around elective or routine procedure delays. With the closure of elective surgeries and procedures, we have seen that have a dramatic impact on budgets. ER visits are down by over 50%. So what many will recognize in their overall budget this year may actually be a cost savings. What we don't know is when all this will rebound. Will it be the end of 2020 that these elective procedures get caught up? Will it be so, much more so in 2021? Will we ever fully make it up? I don't think we will. I think the answer is no to that. As we have an increased capacity for this, the capacity is still the same. It's just the availability is greater now because people are still choosing to delay some of those elective procedures. Some of that will be beneficial in the fact that you're going to be able to actually maybe have some non-essential procedures that were scheduled to actually not be performed and not necessary any longer. The one area I do have concern in is that ultimately some of these chronic conditions, such as cancer and heart attacks and even diabetes, that could increase in future years because routine care is being stopped. So I think it's very important for us to take this holistic look at both sides of the coin here, and the fact that yes, there could be some cost savings, but there could be some cost impact in the future years if we're not sure that we're taking care of some of these underlying chronic conditions that have been impacted by COVID and that will continue to also be impacted just as our population as a whole. And so we've got some things that we think can help you consider what to do to address those. And so now I think I'm going to turn it back to Robert to talk a little bit more about some budget considerations when it comes to the facility sides as well.
Yeah, thank you, Leah. So I really liked the slide that we had for the health plan. So I kind of sniped it a little bit when I was putting this facilities budget consideration slide together. And while I was thinking about this, I was kind of thinking about your 2020 budget meeting and really building that business case for your facilities managers when they're going in, because I would anticipate that a lot of organizations are going to have facilities managers who are going to be increasing their budget or requesting an increase to the budget this year. And there are a few reasons behind that. And so I kind of want to break them down, and I thought about them in four categories. So the first one is going to be equipment for adjusted workspaces. And I kind of mean this in two different ways. So the first one is kind of with the implementation of physical distancing, there are going to be some jobs that inherently look different. I think of a receptionist type role, for example, someone who's historically kind of sat at the front desk, greeted guests, gotten them where they need to go, et cetera. That role may have been eliminated, or that role more likely has been rescoped. Maybe your receptionist is now an administrative assistant or an office assistant, that type of role. So with the elimination of a body in that front seat, we're still going to have clients come in from time to time. We're still going to have deliveries. We're going to have to set up a system of communication there. So that might include, replacing the receptionist with a computer monitor or a TV monitor, purchasing some communication systems to put in place, maybe a front lobby redesign, things like that. So that is one area of consideration, that you may have some facilities kind of redesigning that are a result of COVID. Secondarily, equipment for adjusted workspace. You might have seen this one already. So Google has elected, hey, we're going to go to a work from home model, and we're also going to reimburse our employees up to $1,000 per employee for the equipment that they need to successfully work from home. So depending on the state that you're in, should that be the route that you go, there may be a pretty hefty price tag associated with that. For example, in California, all reasonable and necessary work expenses must be reimbursed, right? So that could be the desk, the phone line, et cetera. And there are a lot of other states that are following suit there. Illinois, for example, New Hampshire is doing the same thing. So even if you do say, hey, we see a decrease in our facilities budget because we're going to be allowing employees to work from home long term, a decrease in budget is not necessarily the case. So be sure that you're reaching out to your HR consultants. If you're an Encompass client, you need help with this kind of thing, reach out to your client experience manager so we can help you in these decisions. The second kind of area is additional sanitation expenses as a result of COVID. Your newest line items are going to be hand sanitizer, soap dispenser, and possibly face masks as well, right? We're going to need specialized cleaning crews, right? If we haven't come back into the office yet, and that office has been sitting dormant for the past 3 months, we're going to need a cleaning crew in there to get that kind of back up before we allow our employees to go back to work. There may be additional HVAC expenses. Maybe we need to increase the airflow, and there's a cost associated with that. So all of these kind of hard costs that are associated with the building itself are going to be an increase to the budget. Third is your workplace safety expenses, safety training expenses. So we've been recommending new policies and procedures for employers as a result of COVID, right? You're going to need your infectious disease kind of prevention policy, that sort of thing. Well, how are we going to get this information to our employees? If you don't have a learning management system, maybe that's something that you need to consider implementing. Maybe additional costs associated with the development of that content, or even just maybe leveraging a system to get that stuff out. These are costs that may need to be considered as well. And then finally, I've got new policy implementation listed as the fourth bucket. And what I think about there is, I think the most obvious example, we've heard a lot, offices are requiring, in a lot of cases, their employees to have their temperature taken before they come into the building. What does that look like? Does that mean we're going to pay a contractor to stand there and scan a temperature or a thermometer over our employees' foreheads before they start work? Are we going to have to pay for some kind of automated system to allow us to do this more efficiently? Additionally, revisions of policies and procedures. Before we put these policies in our handbook, we're very likely going to want to get maybe some legal review or review from an HR consultant, where some of these things are going to have a cost associated. So facilities budgets are really kind of more often than not going to fall under the HR leaders bucket. They're going to fall under the HR leaders umbrella. So it might be a time for you to consider new HR technologies to really streamline your operations and identify some cost savings that you might not be utilizing now. So if you don't utilize Encompass, these are things that we can help with. Please feel free to reach out with us. If you do utilize Encompass, reach out to your client experience manager so we can talk through some of these issues if you are on that kind of budget planning phase for 2021.
And so now that we've kind of talked through the clinical and the cost, we really want to spend a little bit of time talking about how to think ahead and about the future and what you can be doing now to impact things that are to come. And so you'll see here on the screen this slide that says, because the real enemy is disease. And we've actually had this phrase at Holmes Murphy and have talked about this for many years, long before President Trump was saying it in his daily briefings. But right now, COVID-19 is the enemy. It's the virus that you have to figure out how to battle. It's not only impacting the healthy, but it's what I would guess you could call as actively recruiting those with chronic disease. And so we've got to figure out a way to help those that are being targeted by it and help prevent those from getting chronic disease. How do we work to both avoid and reduce disease? Is it possible? I was on another webinar recently, and several questions came up about whose responsibility is it to impact disease? And my response is it's everyone's responsibility. That those that are going to be successful at improving the game of health, which, by the way, is an infinite game, it never ends, will be those that take on this mindset that it's an organizational responsibility coupled with an individual response. See, an organization can only do so much on its own. We know that. It takes the individuals within an organization to actually respond if the outcome is going to change. How do you get individuals to respond? And I would tell you that you come up with a strong battle plan to help them believe they can succeed at attacking that enemy. And on the next slide, you'll see just an example of what we call a disease-specific battle plan. And this plan is unique for each workplace, each organization. It involves many phases. We know that some can be more aggressive and move faster, and some need a more drawn-out attack. What's important is that you have it in place, and it involves data. It involves understanding your population's health, knowing your culture, identifying goals. Some of it will involve vendor solutions, like these digital therapeutics, digital modalities that have really been brought to light during this time, using telehealth and remote monitoring, those sorts of things. And some of it will involve the various plan designs and cost considerations, but all of it is focusing on one outcome, and that's attacking the enemy of disease and avoiding and reducing its impact on individuals. We have seen these battle plans actually put into place and produce results. Metabolic risk has been lowered and in turns reduced the developing of diabetes and cardiovascular disease. Musculoskeletal pathways have been deployed, eliminating pain and those unnecessary surgeries. Care coordination has shown that getting the right care at the right time can really reduce the cost for both individuals and employers. And so that's what I really want us to talk about next is what's ahead. What do we need to be adding to our battle plans to ensure that we can attack this enemy for the long haul? And, as we start looking ahead to the second half of this year, I've heard some people say it seems like we're at halftime with COVID. And I hope we're beyond halftime. I hope we're in the seventh inning instead of just halfway. But what I can likely tell you is there is still a lot more to come with it. And so we've got to think about what we can do to focus on some of these emerging elements that are out there. And while you may not be able to be like Google and contribute $1,000 to outfit your homes, there are certain programs and activities that I would challenge you to consider. Some things we know here that will make an impact on health for years to come. One thing that I'll point out here with regards to telemedicine. So there have been several studies that have come out around this. And in fact, the latest one I saw by McKinsey and Company was that up to $250 billion in healthcare spending could be digitized. And that accounts for about 20% of all Medicare, Medicaid, commercial, home health, all the spending in 2020. Imagine that. Imagine that 20% of what was being done in person can now be digitized. And we've seen that happen already. We have seen that telemedicine utilization has more than doubled. I think it's going to likely persist for the next 12 to 18 months at least until a vaccine is widely available. And as long as Congress continues allowing the same form of payment for the service, that has been a critical component that's been helpful for our providers in doing so. And so the more that you can promote telemedicine and utilizing of that capability within your organization, I think the better off you're going to be. And I think it's going to really kind of set the way that we're going to see a lot of things done in healthcare for the future. When it comes to primary care and preventive healthcare, I know that's been a really big impacted area. We've had several even primary care providers that have had to shut their doors because they weren't able to get the patients in. But the ability to have telemedicine has really started to transform some of that. And we're seeing a lot of these primary care providers kind of shift some of their focus and implementing some of these on-site health stations, utilizing some of their nurses and staff to take temperatures and do that in an employer setting. Some employers that have the ability to have a near-site clinic or an on-site clinic has been especially essential in helping some of those essential workplaces that have not had the ability to shut their doors down and do the stay-at-home orders. So these primary care services have been critical in that part. The point I want to make there is just really consider what you've been doing to promote primary care, to promote telemedicine, and to make sure that your employees have a resource that they can use and go to should they need care. Another big component that has started to see some uptick has been this expert medical opinion service. You maybe have heard of it as second opinion. And so it's been around for several years, typically low utilization while trying to connect users with top specialists for educational consultants and support. But now it's even pivoting to help employers actually have decision-making support tools as they transition back to the workplace, helping with actually referring to offsite screening services, and really trying to help with that group that's had the delayed procedures or diagnosis to really determine if they are still necessary. So if you haven't looked into this space, you should look into it. And you should consider this as being one component to help address that, that clinical connection that we need with our providers. We've talked about mental health a lot already. We talked about the EAPs, but the thing that I want to make sure to still point out here is that many of our EAPs or mental health services and mental health counseling has traditionally been in person. That again has changed, and what we're seeing is a lot with the text counseling and video counseling and online programs that deal with what we call cognitive behavioral therapy and help teach people to understand and do things on their own to address mental health while they're not in an office or not being treated by a provider, even self-service toolkits. So there are, a lot of alternative treatment channels that are vital to the success of programs when a person can't do in-person counseling or may not be wanting to do that. And I think it really opens up the ability for all of our employees to start feeling comfortable and going to a trusted, confidential source to help get the help they need during this time. So if you haven't looked beyond just in person or just a few things online, start investigating those mental health resources that really can get into multiple modalities to help. And then another topic I'll touch on briefly is, and I know this is a little bit of a controversial topic sometimes, but it's around genetic testing. I would recommend that you make sure you connect with a consultant that can help you to determine the most effective way to address this. But I can't go without talking about it. It's definitely on the forefront of health. It will help us to understand disease better and ultimately treatment better. Especially in what we're facing with COVID-19. You probably, or you may have seen some of the studies that have come out recently about how they're learning how that disease has a genetic component potentially to it. I say potentially because they're still, making sure these are good large studies that have gone on for a long time. There's just intriguing information coming out of genetic testing and genetic information, and so one of those being that blood type could even be a reason for or potentially having a greater risk of developing some of these diseases like COVID-19. So what I, again, want to say here is that it is a field that is a little hard to understand and deal with, but it is important, and I do think that it is going to change the way we impact diseases and treatment in the future. And your employees are probably going to ask you about it. So make sure you ask someone that's has a clinical background, that has some education on these types of offerings, to help you understand how you could potentially use that and help your employees with that. And then, one thing that I know may seem trivial in some of this is flu shots, but I couldn't go without calling it out as well, because we do anticipate a very high demand for flu shots this year, based upon our past experience after the SARS-1 and the H1N1 virus outbreaks. There was a significant increase in the amount of people that wanted to have flu shots done after those two viruses made their way. So I expect that will be just as likely to happen this year. On-site flu shot vendors are already reporting earlier than usual activity from employers. Dates for the fall flu shots events are filling up fast, and due to those record demands that they're expecting. So if you haven't thought about how you're going to address that this year, start thinking about that now, and start seeing what you can do to actually bring those things in play. And again, there's the last thing I'll remind you about is that I don't think we can emphasize enough the need to make sure we have digital options available. We have, there's typically been a low utilization of these types of services that has just tremendously increased during this time. I only expect it to keep going. So make sure that you're addressing that within your organization and considering that. It really can be a great scalable opportunity and really help to impact the culture within your organization, to know that you care and you're trying to do everything you can to help them, whether they're in a physical workplace or they're in a work from home setting. And it really shows that the organization is paying attention to and wants to help their employees do what they can from any location. And so with that, I think I turn it back over to Robert.
Yes. Thank you, Leah. I appreciate it. Thank you so much, Leah, for taking the time and really educating us on some of the clinical considerations for COVID. As you said, this is all changing so fast, and I know I appreciate the opportunity to sit here and learn a little bit about some of the health plan implications, and really looking forward and having that kind of future mindset. I appreciate your time, and Matt, thank you so much for joining us. Everybody, I want to open it up for questions now. We've got a couple that have come in. We've got about 10 more minutes. We certainly don't have to take the whole time, but if anybody does have some questions, please feel free to utilize the Q&A feature on your webinar. I'll start with the first one. I see my company would like to know how others are handling notification to employees who have been exposed to a fellow employee with COVID. Either of that person's been exposed or actually been diagnosed. And I think the first thing to kind of think about here is, at this point in the kind of, we'll call it the COVID experience, most employers, if not all employers, should really have an action plan in place to have kind of steps outlined for their leaders to know how to manage these. If you don't have something like that in place now, consider doing that relatively quickly. And if you need assistance with that, reach out to your HR partners, to your HR consultants, because this is something that if it hasn't happened to you yet, and you are a brick and mortar shop and you've got people in your office, more than likely it's going to happen to you eventually. But getting back to kind of the question at hand, if a worker has been exposed and someone else has been exposed, you do have an obligation as an employer to notify the people that have been exposed for their safety as well as the safety of everybody around them. Be sure that when you're notifying these people, you do it in a sensitive way, whether that's email. I would suggest probably a phone call. This is more of a phone call conversation. But importantly, that you've got to maintain the confidentiality that you're required to under the Americans with Disabilities Act. So this doesn't need to be a phone call where you say, hey, Stan, Joe has COVID and he's homesick and you are with Joe. Not like that. Just let them know, hey, there's been a potential for exposure, and then consult the CDC public health recommendations for community-related exposure for the next steps that you need to be taking as an employer. Again, this stuff should all be in your COVID action plan, and if you don't have one yet, please consider looking into that as soon as you can. The second question that I saw come in, really more of a statement, is confidentiality is difficult with an employee population of less than 50. Or absolutely, totally agree with you. I think the distinction that we need to make, though, is there's a difference between an employer disclosure and an employee disclosure. So if an employee comes in and says, hey, I've got all these symptoms, or my wife is sick at home with COVID, and the person that is sitting next to them finds out, that is completely different than you as an employer blasting out an email saying, you know, Joe Schmo was exposed to COVID. Everybody needs to stay away from him for a while. Here are what his symptoms look like. So while I agree confidentiality is definitely a tough thing when in a smaller population, just be sure that your communications as an employer are within the guidelines that the ADA has set forth. But those are all the questions that we have so far. If anybody has questions that come up after the webinar, please feel free to reach out to us directly. We'll try to get you a response in a timely manner. And if there is no more questions, we'll go ahead and end it here and wish everybody a pleasant day.